conversation comes at a very important time. Governments across the world are preparing to open up schools, but we know that many students will not return, and most will be challenged to catch up with all the lost learning. Girls and children with disability run the risk of being the furthest behind. This is why we are pleased to bring together organizations that have been working to bridge the gender equality in education and inclusive education movements for some time, so they can share with us their expertise, their innovations, challenges, and learning on how to ensure that in the post-COVID-19 phase and beyond, organizations that have been working to bridge the gender equality in education. I'm sorry, I was interrupted by my own voice, pardon me. Girls with disability do not become further marginalized in education. This webinar will include 2 sets of presentations. Each set of presentations will be followed by a very short question and answer period. And then we will be showing 3 short videos from youth advocates with disabilities, sharing their experience of the pandemic and recommendations to build back more inclusive education systems. Now we have just a quick couple of points for housekeeping, in which I'm expecting the slide to come up any minute. There we go. Most of these points you know already, as we've been participating in many webinars. Please use the question and answer feature at the bottom of your screen to post the questions you'd like to have shared with the presenters. And you can see that we have interpretation for you today. Please speak slowly as my little message to all the presenters. And for those who sign, please pin the video as shown in the video on this slide. You can see how to do that. If you're having trouble keeping on this link, please know that you can watch the webinar on our YouTube if you prefer to do that. We're going to post that link in the chat feature. Now I'm going to pass over to my friend and colleague, Nafisa Babu. She is the Director of Inclusive Education at Light for the World, to ground our discussions today up in some real life context. Over to you, Nafisa.
Thank you, Nora, and welcome everyone. You know, for many years, we have done many years of work to ensuring that the right to education for girls, and in more recent years for girls with disabilities. Something I am extremely proud about and pleased about, because I would not be where I am today if it was not for the education that I received. We know, however, that girls with disabilities face a multitude of challenges, additional challenges because of their disability and because of people always question the value of actually educating a girl. The COVID pandemic has given us even more challenges and amplified the disparities that faced by girls with disabilities and mothers with disabilities. And I'm talking about the deaf girl in Brazil who watches her siblings listen to the radio lessons, and she wishes that she could go to school and also learn. And I'm talking about the blind girl in Burkina Faso who was excited about writing her end of primary school completion examination, but now she's not sure how prepared she actually is because she doesn't have a textbook in Braille and the technology that she needs to be able to access the material on the government website. I'm also talking about the first grader in India who's just got a wheelchair so she can go to school, but unfortunately now she's at home with her mother and her mom is illiterate and unable to teach her how to read. So many of these girls are not learning and often are taking care of younger siblings or doing housework, longing to learn and go back to school. And some of the parents are making difficult decisions around encouraging their girls to get married so they have a less mouths to feed in the household. But today, I think what's really encouraging is we will be learning from several organizations here about their efforts to make sure that girls with disabilities are getting an education they deserve that can transform their lives and secure them a better future and career. So I welcome you to listen and learn with us and be inspired.
Great. Thank you very much for those encouraging and interesting words, Nafisa. Now, I'm going to quickly introduce the three speakers who will come after this. First, we're going to hear from Matthias Eck, who is a researcher at the Global Education Monitoring Report, and he's going to walk us through the gender dimensions of their recently released report. Many of you will know about the Inclusive Education All Means All annual report. Second, we'll hear from Samuel Katembo. He's the program manager at Leonard Cheshire, Kenya, and he will speak about the work they have been doing over the last period of time, the COVID period. We will all watch a short video shared by Maria Njeri. She is the lead citizen reporter for Leonard Cheshire's 2030 and Counting project and a powerful advocate for inclusive education in Kenya. And finally, in this series, we will then hear from Dr. Ananda Pudel, Head of Programs for Inclusive Education with VSO Nepal. So now, with not anything else, I will pass it back to Matthias. Over to you, Matthias.
Yes, thank you, Nora. Well, first of all, I would like to thank Yungai very much for giving us the opportunity to present at this webinar. And as Nora has just mentioned, my presentation is based on the 2020 Global Education Monitoring Report on inclusion and will thus serve as a general introduction to the topic of this webinar. Okay, so to start with the next slide. All countries committed to inclusive education when they signed up for SDG 4 to be achieved by 2030. Now, this is a commitment we cannot afford to lose sight of, and if anything, the case for it has become stronger. We refer to inclusion as a process that embraces diversity and builds a sense of belonging to achieve social cohesion. These actions are rooted in the belief that every person has value and potential. It is about neither discriminating against nor rejecting anyone. It is about adapting to learners, making accommodations, and not about learners adapting to the system. So the case for inclusion has been championed by those supporting the rights of people with disabilities, who ensure that the right to inclusive education is guaranteed in international law. But inclusion is not about one group only. The mindset and the mechanisms that generate discrimination and rejection are the same for all those who are excluded. And every society needs to own up to the mechanism that exclude. Next, the report finds that identity, background, and ability still dictate education opportunities. The discussion of inclusion has to start from the 258 million children, adolescents, youth who are out of school. In 14 countries, children with disabilities are 2.5 times more likely never to go to school than their peers. Data from Afghanistan, for example, shows that school attendance is especially low for girls with disabilities, and much lower than for boys with disabilities. The world set a target for all to complete secondary school by 2030, but in at least 20 countries, not a single poor rural woman does. Stigma, stereotypes, and discrimination mean millions are alienated inside classrooms and less likely to progress through education. LGBTI students, for example, in the United States, are 3 times more likely to stay home from school because they feel unsafe. Now I'm moving on to COVID-19, which has added a new layer of complexity. Many online solutions to learning community have been inspiring, but we know for sure that they offer only a partial substitute for the education experience. Disadvantaged students have been the least likely to benefit because they lack the right device, internet connection, or home environment. Now 40% of low and lower middle income countries has taken no measures to support disadvantaged learners during the school closures. And as the report of the World Bank has shown, many remote learning options are not accessible to blind and deaf learners. In some instances, parents and families are not able to support their children in using sign language or braille text, for example. So for hundreds of millions of students, learning stopped, and some may not go back to school if their family was plunged deeper into poverty. And there's a growing concern that children with disabilities will be disproportionately represented in this group, as parents fear for their health and safety and keep them back at home. At the same time, we can also consider the pandemic as a catalyst for change. So innovative COVID-19 learning strategies do exist. For example, in April 2020, the Ministry of National Education in Turkey launched a mobile application for special education learners, which aimed at ensuring continued learning opportunities for children with hearing or visual impairments, intellectual disabilities, or autism spectrum disorders. And as of June 2020, 175,000 users have downloaded the app, and even 370,000 users were accessing the training video, the recommended activities, special education lessons, and supplementary resource books of the website. Moving on, there's one key overarching recommendation for all those involved in education. Inclusion cannot be achieved if it is seen as an inconvenience or if people harbor the belief that children's capacity to learn is fixed. So the report calls on all countries to widen the understanding of inclusive education to encompass all learners, regardless of identity, background, or ability. Yet, many governments do not base their laws and policies on this principle. The report found that 68% of countries have a definition of inclusive education, but only 57% of definitions cover multiple marginalized groups. Next, inclusion is not costly by definition. So simple gestures and ways to manage a classroom cost nothing and are the most valuable contributions to inclusion. Still, efforts need to be made to ensure that we get equity and inclusion right through funding. And there are actually two parts to this story. First, education ministries tend to allocate general funding equally to local authorities or schools, which is politically simpler, but does not take the disadvantage that some are facing into account. Second, education ministries need to think how not only their budget, but also how the budget of other ministries can help target students and families most in need. So for example, social protection programs in Latin America have increased education attainment by up to 1.5 years. There is actually no ideal funding mechanism. Countries vary in history and understanding of inclusive education and levels of decentralization. But some countries are moving away from assigning funding to each type of need, which may inflate the number of students identified with these needs. Now, these decisions are even more critical in the face of COVID-19, which our recent policy paper estimates. Risk setting aid to education back up to 6 years. Now I'm moving to the powerful concept of universal design, which refers to making products and services usable for all people. In education, it has been associated with accessible school buildings and flexible learning environments, but this idea of flexibility can be applied more widely. It is not only critical to ensure mainstream education is designed for all, it is necessary to develop targeted support also to address the specific needs of children with disabilities. So all students should learn from the same flexible, relevant, and accessible curricula. Yet many countries modify curricula to exclude or separate. So textbooks can exclude by perpetuating stereotypes through omission and misrepresentation. In many countries, girls and women are underrepresented in textbooks, or when included, they are depicted in traditional roles. And representation of persons with disabilities is even more neglected. Another point is assessment. It should allow students to demonstrate learning in a variety of ways. It should not be a mechanism forcing weak students to leave school early, but a tool to improve students' learning. Next, and very importantly, what data are collected and how they are used determines whether inclusion is served. Identifying groups to make those disadvantaged visible, helping to prompt action. But doing so can also reduce children to labels, which can be self-fulfilling. So in order to avoid that, Portugal, for instance, has a non-categorical approach to determine special needs. Censuses and surveys help monitor outcomes at population level. But gaps remain. Since 2015, 41% of countries have not had a publicly available household survey to provide disaggregated education data. Formulating questions on nationality, ethnicity, religion, sexual orientation, and gender identity can touch on very sensitive personal information. It can be intrusive and trigger persecution fears. But data on and for inclusion for gender equality in education is crucial to determine who is left behind. And those who face multiple discriminations and inclusions due to their disability status besides their gender are those who go uncounted and are not visible in the data, a vicious circle that needs to be addressed urgently. Yet progress has been made. The measurement of disability, meanwhile, has caught up with the times through the Washington Group's question and the child functioning module. Given the difficulties imposed by the COVID-19 crisis, countries have had to grapple with what data to collect and how to collect it to monitor learning equity. Moving on with the recommendations of the report, parents and communities may not believe that inclusion is possible and desirable. Parents of vulnerable children may also have genuine fears that their children are not served well in mainstream schools. And this actually makes it critical for parents and communities to be able to voice their concerns and be invited in the design of policies on inclusion in education. Around a quarter of teachers in middle and high income countries report the high need for professional development on teaching students with special needs. But teachers should not be taught inclusive approaches as a specialist topic. They should be the core of their education. We should remember that teachers are not immune to social bias either. Their education needs to tackle entrenched views of some students as being unable to learn. Now, the World Bank study shows that in the wake of the COVID-19 pandemic, 33% of teachers in North America and 41% in sub-Saharan Africa reported a need for greater training for inclusion. The overall objective is to ensure that all children attend a local school and receive the support they need. But laws in 25% of countries still call for students with disabilities to be educated in separate settings, and another 48% call for at least partial segregation. A legacy of segregation means that human material resources to support the diversity have been concentrated in a few places, and they're actually unequally distributed. So mechanisms and incentives are needed to share specialist resources and to ensure that such expertise supports all mainstream schools. Next, partnership is the key word for government efforts to achieve inclusion. First, education ministries must work with other ministries to share data on disadvantaged children to integrate services using common standards. And second, education ministries need to ensure that when the local governments have a mandate to provide services for inclusion, they are fully funded and the capacities of local officials are developed. Governments should also work with NGOs, which play key roles in making the case for inclusion as advocates and watchdogs, but also providing key education services, supporting groups that governments do not reach. Now, during the COVID-19 pandemic, DPOs have been active both in providing support to their members and building the capacity to contribute to inclusive education policies in the emergency period and for the future. For example, the International Disability Alliance has been holding regular webinars to build the capacity of their members to lobby for inclusion, both during and after the pandemic. So moving on, we are excited to also launch a new website with this report, which is called PEER. In its first edition, it includes profiles describing how every country actually approaches inclusion in education through its laws and policies. And we use these profiles to map trends on selected issues by region. We believe that much can be learned from countries sharing experience and want to see PEER supporting regional or sub-regional processes. Now, finally, in closing, I would like to underscore that in a world increasingly faced with uncertainty and precariousness, inclusion has to be central to the future of education. I would also like to alert you to the GEM report, launching the gender report on the 9th of October, which coincides with the International Day of the Girl Child on the 11th. Now, this report will offer a much deeper analysis on how inclusion in education can advance gender equality in and through education and make education more inclusive and equitable. And as you may know, the 2020 gender report also coincides with the 25th anniversary of the Beijing Declaration. So it will use case studies to actually provide an overview of progress in gender equality in education over the past 25 years, highlighting how progress has not benefited all and many are still left behind. I'm very much looking forward to the discussions today, and I will give over to Samuel now.
Super. Thank you very much, Matthias. Samuel from Leicestershire, over to you now, please.
Thank you very much. So I'll present the case of Kenya, and specifically I'll present the results of two key assessments that we conducted. One was an assessment that we conducted immediately just before the entire COVID-19 crisis, and one was an assessment that we conducted after, or let me say during the COVID period. So we have a clear picture of what the situation is in Kenya, and specifically the western region of Kenya, the Nyanza region. My name is Samuel Sanda Katembo. I'm the program manager for Lona Cheshire, the GCT project. Let's move on. Next slide, please. Okay. So apparently in Kenya, the COVID-19 crisis affects about 17 million learners. And this is because on 15th March 2020, the Kenya government declared all schools or all learning institutions closed. And it's expected that the schools will reopen in January, but the government has not given an absolute commitment on that. And even if January comes in, we are not sure if all children will report to school because of the safety measures, we are not sure if the schools will be able to accommodate the learners within the World Health Organization directives, and we're not even sure if the parents will feel safe enough to take learners back to school. So we are seeing the learning environment for children change. And yes, we as stakeholders, as NGOs, as government, we need to rethink the learning process of how learners will learn at school, and specifically girls with disabilities and learners with disability. Next slide. Moving on, please. Let's move to the next slide. I'll give us a brief introduction of the project I work with. I work for the Girls Education Challenge project. In Kenya, we support 2,100 girls and 678 boys. The project runs from 2017 to 2020, and we work directly with 83 educational institutions and more than 60 other educational institutions indirectly. We work in 5 sub-counties in the Lake region. The Lake region is in the western side of Kenya. And the project did a learning assessment to determine the possibilities of building alternative, or let me say a community learning model to support learners with disabilities at community level, at household level, and try to see how feasible such a model is. Thank you. So next slide, please. Okay, so we'll discuss the key barriers that were identified. So I'll talk about the key barriers before COVID or pre-COVID, and we'll talk about the key barriers that the girls are facing currently. Because in Kenya, we are still in a period of uncertainty. We are saying that the peak for COVID has not reached yet. So there's a lot of uncertainty about learning at all. So I'll talk about the current situation and the situation before COVID, based on reports and empirical evidence that we have as a project. Thank you. Next slide, please. So pre-COVID, the key barriers that we had identified then were mostly around access to school and quality education. And specifically, if you look at girls with disabilities, we noticed that schools are not providing materials that were accessible to girls with different impairments. So I'm talking about mainstream schools. I'm talking about mainstream schools that are accommodating learners with disabilities. In addition to that, in addition to lack of resources, lack of learning materials, we had a lot of discrimination and bullying within the learning environment. So we'd find that children or learners with disabilities, and specifically girls, were being bullied or being discriminated in the learning environment. And this really hard for girls with disabilities compared to girls without disabilities. This comes from an evaluation that we just concluded in January 2020. We are looking at lack of proper teacher training. So we have very trained teachers in mainstream schools that can cater to the learning needs of learners with disabilities. We have lack of assistive devices. Poverty is again a big barrier for learners with disabilities, since it exposes especially girls with disabilities to various gender-based violence risks. This includes pregnancy and child marriage, which is again a bit rampant We also had some aspect of violence against girls and gender violence against children. The aspect of corporal punishment is still a big barrier to children, and specifically children with disabilities. If a child knows that they're going to school and they're going to be punished, yeah, it will prevent them from going to school, and that is again a barrier to access to education. We have in Kenya, we say we have very good policies. Yeah? We've made very nice laws. Some of the policies are sometimes is very poor. The implementation of policies and even the funding, because policies need resources to get implemented. The implementation of these policies is very poor, and it leads to improper allocation of resources at school level to accommodate learners with disabilities. We are talking about also inaccessible and unsafe environments within the, specifically the girl has to walk from home to school, especially in a rural setting. That walk from home to school sometimes proves to be a barrier because some of these girls get intimidated along the way. They get exposed to perpetrators of GBV along the way. And some girls are even saying that they're afraid to even walk to school because of various dangers that they face between their home and the learning institution. So kindly, can we go to the next slide, please? Next slide, please. Oh, thank you. So the key barriers to access to school and quality education highlighted after COVID emerged and the lockdown came in and the closure of schools. This again is based on another study that we did after COVID came in. We noticed that there were various channels of learning that were brought forward by the government who proposed. There was learning through radios, there was learning through TVs, there was learning through smartphones and technology or computers. But then the rural girls or the rural children that are composed of a majority of the children we have in the country have limited access. And even if they have access to this technology, we find that some of the content delivered through these technologies or these media is not adequate to their because we find that learners who have visual impairments, learners who have hearing impairment cannot adequately get the content that's being delivered through this that we're talking about. Yeah. And going further, the COVID-19 period exacerbated the poverty. Yeah? We saw the economic burden on parents become much higher. Some parents down during COVID. Again, when the economic burden at home becomes high, the GBV risks also on the girls also end up with fathers being exposed to child marriages, again, pregnancies, and a lot of other GBV issues. Because these children are now at home, some of the children actually considered the school as a safe space, and now we have these children at home, and the parents have to go to work. Parents have to go out to look for money and all that to feed the families. Yeah. Going further, we see that lack of accessible learning content to GBV. I've talked about that. And then there was the obvious one, yeah, exposure, the risk of exposure to COVID-19 risks. So, because of the we work mostly in rural communities. For some communities that we work with, they're yet to accept COVID as a real disease. They believe it's still a myth. They believe it can't affect them as from where they are. It's a town disease. It can't come to risk to exposure to COVID-19 as an infection itself. We are also looking at inadequate follow-up and monitoring due to this. So most of the interventions or most of these girls were monitored at school level. So now that the schools are closed, there's very limited monitoring, and also because of the limited movement that the government has imposed, we can't move around and see what's happening in the homes. So that exposes the girls to either the severity of the disability increasing or further exposure to child protection risks. So how have we responded to these barriers as a project? So we've tried to do weekly phone call follow-ups with the girls, trying to contact the households. We work very closely with community resource people. So we contact each community has various community resource people. So we've come up with resource people in turn do follow-ups within their own communities to see how the girls are doing, and they can report the child protection risks, if the child protection risks and all that. So we've also opened up a toll-free line. So the toll-free line is free. People can call in, the community can call in, and they can get quick information, quick advice. If it's a challenge, disability, there'll be somebody on call to respond to their issue. We also distributed dignity kits and hygiene packs. Again, in the country where we are in Kenya, most of these sanitary kits through school. Now that the schools are closed, some of them don't end up getting these kits. It becomes a problem. So as a project, we've tried to come up with a way of ensuring they can by delivering the dignity kits or doing some form of cash transfer where the parent can get enough money to access these dignity kits. Additionally, we piloted some distance learning tools. We piloted some distance learning tools. Kindly go to the next slide. Sorry, kindly go to the next slide. Okay. So through these distance learning tools, we are looking at what the government has done. So their daily education, we are trying to leverage on what the government has done. So the specific items are their daily educational broadcast over radio and over TV. So we are trying to look at how we can organize our children around that and have somebody support them as these broadcasts are going on. We have a Institute of Curriculum Development coordinating some of these broadcasts. We also have a TV channel, a specific TV channel that's both on broadcast and on YouTube, where the children can tune in, and there'll always be a teacher teaching, and this is usually timetable. There's a specific timetable. So the project is also trying to leverage on that to see if they can organize the children in small groups so that they can. The government has also provided free electronic copies of textbooks, government certified textbooks. They're available on smartphones, and you can download them on your laptop and all that. But then this model is very good, but it does not work for learners work for all learners who have disabilities. And because some of these learners require very adapted methods of learning, they require for learning. And we're trying to see how we can partner with. We're also trying to partner with institutes like the Kenya Institute for the Blind, who can easily convert some of this content into content that can be accessible for learners with disabilities. So that we're acknowledging the fact that the government has done a lot, but then there's a lot more that needs to be done for learners with disabilities, especially in Kenya, and learners with disabilities who are in the rural settings. Thank you. Can we proceed, please? So how are children learning at home currently? From a recent study that we did, again, we have 87% of children with disabilities are studying. So children are studying at home, but then most of these children that we talked to are studying using their school books, their notebooks, whatever notebooks that they carried from schools, the ones that had handwritten notes. And also we had some who had access to textbooks. About 73% had access to textbooks. Also, of those who were not studying at home, some of the reasons that they gave out for not studying at home was that there was lack of studying. The availability did not allow them to study, use the materials they have to study. And we also had some students feeling like they cannot study without the presence of a teacher. Can you proceed? So what happens when the head of, sorry, you skipped a slide, please. Okay. So again, one key aspect that we also notice is that the fact that most parents at home did not have the knowledge to, or the ability or the knowledge to support some of these learners at home, because some of them are parents who did not actually go to school, and they feel like they do not have the adequate capacity to support these learners. So some of the main challenges that were presented by the parents or girls was that there was lack of access to education resources, and also the parents themselves feel like they do not have the skills to support home learning, especially when it comes to supporting the additional needs of children with disabilities. So the fact that them themselves do not have the skills, the they felt like even to support a learner who has a disability that requires adapted materials is very difficult, because they themselves are not skilled enough to support that kind of learner. Especially if you look at a learner who requires Braille, a learner who requires sign language and all that. So the main challenges, again, that were reported by the teachers during the same assessment, that 81%. Sorry?
Samuel, I'm going to have to interrupt you. This is extremely interesting and really important material, which we will share with all the audience afterwards. But can you, because of time, we're going to have to ask you to try and wrap up. Can you please do that?
Okay.
Thanks very much.
Okay, I will. Thank you for that. So yeah, we also talked to the teachers. So 81% of the teachers cannot reach the children through remote learning of technology. If I try to summarize this, one thing that also came out is that both the teachers and the learners are willing to interact. So both the teachers felt like they really need to reach out to the children. The children felt the need of continuing to study. So there's that need. All these children. The only thing that these children require is the support, is the learning material, and support to support the children. So according to these teachers, they felt like if we provide the children with access to smartphones, if we can provide them with access to data, then these children can access some of this content. And if we can provide adapted content, or content that is adapted to the specific learning needs of learners with disabilities, then it will go a long way into ensuring these children can learn at home. So yes, we can leverage on ICT, but then an overall solution to learning at home for these children. So what needs to happen when the schools reopen? So the government needs to plan way ahead. If we are opening schools in January, the government needs to plan way ahead on how to re-enroll some of these children. Again, there's a high risk that girls will not come back to school. Children will not come back to school, but there's a high risk for girls because of, again, pregnancies, increased risk of poverty at the household, and again, there are so many factors that might limit girls, and specifically girls with disability, to access schools. And then we also need to understand why girls can't come back to school, so that we can intervene on the specific needs that these girls face that might inhibit them from going to school. So currently, I'll just find out. This is the last slide.
Samuel, okay, thank you very much. Sorry to interrupt you. Pardon me.
Okay, this is the last slide. So we just work through the support of BFID. We also fundraise on our own as Learner Cheshire to see that we can support these learners with disabilities, and we also have additional resources that are available. We also provide additional resources to teachers so that they can get better connectivity and suitable materials for learners with disabilities. Thank you very much. Sorry for going beyond my time.
That's great. Thank you very much, Samuel. It was super interesting, very rich presentation. And again, we will share the slides so that you can actually review them yourselves. Now, we're going to turn without a break to our video. So please, now we'll listen to Maria, and you can read her slides too, her presentation.
My name is Maria, a diversity and inclusion expert from Kenya, working with the UNESCO GEM on its youth advocacy programs. I use my personal experiences living with cerebral palsy to advocate for the rights of others. An important factor in ensuring no girl is left behind in education is in recognizing we are safer in schools and in controlled learning environments. Most girls with disabilities are extremely vulnerable, living in high-risk environments. In school, where they are being monitored and supported, minimizes their chances of being abused and harmful practices, and increases their chances of achieving their fullest potential. My vision for the reopening of schools is they should consider each girl requires a diverse, reasonable accommodation. In ensuring every girl with a disability has access to their reasonable accommodations, will create enabling spaces to guarantee inclusion is possible. Thank you.
Great. Now we're going to move straight on to hear from Dr. Pudel. Please, over to you now. Thank you.
Thank you. I'd like to provide my sincere thanks to Angai team for providing this opportunity to share some of the learning that we attained, BSO Nepal attained during crisis, with more focus on the girls with disabilities. So I will be touch upon the brief introduction of project, at the same time how we respond our primary actors or the girls with disability. At the same time, what is the main impact, major impact that our girls with disabilities are facing during COVID crisis. At the same time, I will also touch upon some of the programmatic response and adaptation to address the challenges and also the impact. At the same time, I will also highlight some of the challenges and some of the mitigation measures that BSO Nepal has been adopting. And finally, some of the safeguarding initiatives to protect, shape our girls with disabilities life and some of the learning that we attain. These are some of the areas that I would like to share Nepal, BSO Nepal's experiences. Next, please. So we are right now implementing the Girls Education Challenge Fund related one of the project. We called it as Engage, empowering a new generation of adolescent girls with education. So this project has supported by the DP Leave No Girl Behind window, GEC, under GEC. So the main objective goal of this, the project is to improve the learning opportunities and outcome for those out of school marginalized girls as well as the disabled girls. So if you see the project scope, we have been working on 3 districts of Nepal and 7 different local government municipalities, and also we have been working in 33 project schools where disability, the girls with disabilities are high number of disabled girls. Next slide, please. So if you see the reach, we will be reaching in 4 years duration period, we will be reaching 30,000 overall, and mainly focusing on marginalized and disabled girls, 25. To 25 girls. And the main outcome of this project is learning, transition, and sustainability. Learning means literacy and numeracy. More focus on the basic education. At the same time, transition is that the transition from non-formal education to formal education, and transition from non-formal education to livelihood skills. At the same time, sustainability of their learning and the business skills. These are some of the project outcomes of this project that we have been right now implementing in Nepal. Next, please. If you see that, how BSO Nepal listen the disabled girls during this COVID scenario. So we have initiated 2 major survey. That is one is the online tracking, and second one is the well-being survey. Through these 2 survey, we have been reaching the girls with disabilities. The main purpose of this survey is to understand impact of COVID on marginalized girls, including girls with disability, particularly focusing more on learning, well-being, protection, and access to information, and etc. So if you see the information collected area, so we have been we have collected the information regarding the access to education, communication, and the connectivity. At the same time, continuity of learning, their feeling and experiences during the COVID scenario, and educational learning status. At the same time, availability of food, mental pressure, whether they are living in a mental pressure or not, mobility and access to information related to COVID, as well as the related to learning. At the same time, what is the status of educational deprivation and access to health facilities and livelihood options. So these are some of the area where we have been initiated these two, the survey, and based upon these two survey, we have, identify some of the impact of the COVID, particularly focusing more on the girls with disability, and adapted the program and response and adapted the program intervention accordingly. Please move ahead. Next, please. So if you see the impact that these two results has, they identified. There are four major impact. One is the limited access to girls, basically the disabled girls, to education, healthcare, communication, and other part. Second impact is that there is increasing risk of COVID infection because of they are unable to access the available services, health, education, and their health condition itself is not very good. So at the same time, government has given low priority on the people of disabled children. So this is the second impact of the COVID that we found. Third impact is that discrimination and injustice. We found that there are lots of discrimination and injustice cases has been increased. For instance, gender-based violence cases has been increased in the community. At the same time, early child marriage cases has been increased, and heavy engagement of children with disability and other marginalized girls in the domestic chore. This has also increased the risks of the violence and harassment, particularly focusing more on the girls. So this is the third impact. Fourth impact that we found is that the discontinuation of education and learning because of the COVID, the primary actors or these girls are discontinuing their learning and education. That is another impact. These are the four major impact that we have explored. From these two initiatives that we have taken. Please move ahead. As per this survey's finding, what we did is that we have adopted some of the program and also discussed with the fund manager and developed some of the COVID related plan. So this is the major adaptation and response to address these, the impact. So you can see that one is the online tracking system. We have established the online tracking system to reach all disabled girls. Second part is that we also raise the awareness activities and different initiatives through mobilizing different modes. The radio, TV, and other media. At the same time, we also use the volunteering for development approach. You know that the PSO is using in different projects volunteering for development, meaning that we are using the national, international, and community level volunteers. Their role is to support our marginalized girls and the girls with disability in their learning, education, and other health related issues. So we are also promoting this volunteering for development approach. These are the commonly used intervention that in all project districts, 3 project districts. With regard to the specific intervention to the disabled girls, we have also initiated some intervention to address some of the impact of the disabled girls. One is that the relief and response. We also initiated some of the relief and response activities. We have provided food, health, and hygiene kit, which also include the sanitary pad and other personal health related items, so that they will have the better safe and safety during this COVID scenario. At the same time, we have also initiated psychosocial counseling to them through distance mode. We have also hired and utilized some of the professional counselor to address some of the trauma and stress that the disabled girls are facing. So second part is that the major intervention that we have initiated for the disabled girl is the psychosocial counseling through experts as well as the community volunteers. We call community volunteers, they are the same community, living in the same community, and they will provide, by utilizing the safety and security measures, so maintaining social distance, they could also able to provide and support our disabled girls in the community. we call them as a big sisters in a project language. So they are the community volunteers. At the same time, we have also initiated some of the networking collaboration with different institutions, government, because BSO is not able to address all these things because we have been implementing the education project, not the emergency project. However, discussion with fund manager and the donor, we have able to design some of the response. At the same time, this is not able and educate to address all these needs of the disabled girls. So we have initiated some of the linkage with the government response plan and also address some of the issues and impact of the disabled girls they are facing in during crisis. Next, please. So we also observed some of the challenges with regard to girls with disabilities. One of the challenges that we found is that the information deficit, required information for COVID related as well as the learning and other health and hygiene related areas. So that is the one part, information deficit. That is one of the major challenges. To address this challenge, we have initiated a number of initiatives. For instance, public service announcement, radio messages, SMS, audio, visual, and printed material in sign language and braille to increase the access to information and some of the learning in our project districts, 3 project districts. So that is one part, one major challenge. Second major challenge that we found is that the capacity deficit and capacity of the project team, capacity of the big sisters, capacity of the teachers. So I'm mainly focusing on the gender-based violence, child protection, duty of care, enabling environment for the disabled children. So these are the area where capacity deficit is the major challenge. So we have initiated training and orientation program to all staff, more focusing on gender-based violence, child protection, duty of care, and how to create the enabling environment so that our children with disability will have access to information and they can respond and they can also consult with the concerned authorities. Third challenge is that the traditional mindset of the parents and the teachers, particularly focusing on the disabled girls. So to address the challenges, we also initiated parental awareness, information, education, and communication materials, develop different type of information communication materials and distributed to them, also mobilize the big sisters, those are the community volunteers, to orient and support our girls with disabilities. This is the third challenge that we have addressed. And fourth is that the resource deficit, because of the high demand, we did not able to have all these things. So we also initiated some of the COVID response plan as well as the linkage with the government. These are some of the challenges and mitigation measures that we have adopted. And based upon our 2 surveys, I will just touch upon that. We reach the all primary actors. We call direct beneficiary as a primary actors. So through online tools, we reach all the primary actors and find out some of the safety, well-being, protection, and safeguarding needs. And we also assess that whether they have the access to radio in order to disseminate the awareness materials and awareness message and learning. So we found that the 60% parents were using their mobile, 40% parents do not have access to radio and FM. For them, we have developed printing materials and distributed them and utilized the community volunteers. At the same time, what are the major source of information that our disabled girls are getting? We found that the majority of the girls are receiving the COVID messages through our community volunteers. And second source is the radio and FM. And third source is the community volunteers networks. So these are the 3 main sources of information that our girls with disabilities are getting information related to COVID and learning. And we are also initiated some of the safeguarding activities because this is one of the major impact of the COVID, increased child marriage, increased gender-based violence, and our sexual harassment in the community. So that we need to have addressed this impact through our initiative. So you know that our project has made the GEC safeguarding standard, international standard, implied by the donor. And this project is one of the first project to meet this standard. That is one of the good initiatives that we have initiated on protection and safeguarding. So second part, we are also using the regular monitoring. Please back, please. Could you go please back?
Hello, I'm sorry, you're going to have to wrap up, please. So
Okay,
that's why the
okay.
slides are moving ahead.
So,
So we'd love to hear your last
okay.
message. Go ahead.
So major learning. Okay, thank you, sir. Major learning is that, mobilizing community volunteers are supporting marginalized girls and girls with disabilities. And second learning is that the coordination with organization, with people with disability organization is also very useful to listen and they identify the barriers and address the need of the disabled children, as well as the developing the materials and other part, and role of the and the regular coordination with the local government is also, the major learning. And also referral mechanism, linking with the referral mechanism is also one of the learning that we did. Finally, distance learning is also supportive and possible even during the COVID scenario. And last but not least, female volunteers have been the important role models in this crisis, because we have the national volunteers from the disabled field. The person who having some sort of disability, having female disabled volunteers are communicating better and also reaching our disabled girls in a more efficient and effective way. And they are supporting very much during this crisis scenario. So these are some of the major learning that we have been replicating, not only in Nepal, BSO Nepal, but other projects, other organizations as also. They are requesting to have this type of learning and sharing. Thank you. Thank you. If you have any questions, then I will be ready to respond as per the.
Excellent. Thank you very much, Dr. Ananda. You can please take a look at the questions in the feature below this on the bottom of the screen and type in some brief responses. Our challenge today is we have a whole lot of stuff to cover and it's very rich and detailed. So rather than slowing down and having some questions and answers, we're going to invite all the panelists to take advantage of the written space on the question and answer feature. So please go back to that space if you have raised a question. You might be lucky and get some hot tips from our presenters. Now we're going to go straight on and hear from Harrison, who is a VSO volunteer in Nepal.
Hello, my name is Harrison Karaoke. This is my sign name. I'm deaf. I was a teacher in Kapsabet Secondary School for the deaf. This time of coronavirus, I work online with YSD and the chapter that is used for sustainable development. We work together to empower girls with disabilities. We build their capacity on life skills, reproductive health. At the same time, we teach about hygiene. Now, in time of COVID-19, we have challenges and which girls with disabilities are experiencing. In education, in Kenya Institute of Curricular Development program, we have online learning. And remember that girls with disabilities, some are from poor families. For example, deep in the villages, a deaf girl have no access to TV. And even the radio, she cannot access the information, and that's a challenge. At the same time, it's about pregnancies. They will stay at home, they cannot go back to school, and that's a challenge. There's also the issue of gender-based violence. They cannot run away, they cannot even voice. It's a challenge. At the same time, there's no support. For example, with people with autism, there's no support. At school, they are given support. They are assisted, but at home there is no such kind of support. Also, the kind of materials, they are not available. In schools, materials are available, but at home they are not. At the same time, there is poverty. Parents of girls with disabilities, sometimes they cannot even pay for a smartphone or a laptop. So now I want to recommend, we must have a policy to protect in case of pandemics. For example, chiefs can be there to assist. At the same time, we need an inclusive education program, and also there must be access to technology so that girls with disability can access it. Thank you.
Thank you very much. I need to correct myself. I had said that Harrison was from Nepal, and he's clearly not. He's from Kenya, so pardon me for that mistake. Now we're going to go straight on and now hear from Juma Kamara, who is the rehabilitation. Sorry, I've just lost track of my list here. There we go. He's a rehabilitation and inclusion technical advisor with Humanity and Inclusion in Sierra Leone. Over to you, Juma.
Good afternoon, all. My presentation will be looking at how Handicap International is supporting inclusive education during the COVID-19 using adapted approaches. And for sure, we all may aware that the GEC project itself started since 2013, which we could refer to as the first phase of the project. And it was followed by a second phase. And that particular first phase, which started in 2013, was hit by the Ebola outbreak. And so it was redesigned, and we had a second phase. And now we have the transition phase. That's why we call it the GECT. And unfortunately, we all know what has happened. The COVID-19 has also struck. But we are a resilient country and resilient people. The GEC project itself seeks, and one of its main vision is to ensure that marginalized girls and children with disabilities are able to overcome the barriers they face in the education. Thereby, they are able to learn, reaching their full potential and transitioning from primary to junior secondary school and beyond. You may want to go to the next slide. Yeah, you would find out that in the Sierra Leone, we have 34% of literacy rate, which are female, and 76% of the dropout children, which are children with disabilities, are out of school. And the GCT itself seeks to target a total of 2,284 girls. And from that number, we have 478 girls with disabilities, and the total beneficiary list is total at 3,112. That will lead us to the next slide. Over the period, the project itself has been implementing so many activities, and we have been registering so many gains. Taken from the in-service teachers training for teachers, pre-service teachers training, the study groups that we have been conducting. We also set Village Saving Loans Association. This primarily is constituted of beneficiaries' parents, so that they will be able to support their children to go back to school. And we have been providing assistive devices. Of course, a whole lot of barriers has been around the aspect of education, and failure to which, if we do not provide this assistive device, children with disability will not be able to access education. And furthermore, being that we are promoting inclusive education, we want to ensure that whatever barrier, to our possible best, we try to see how best we can modify, eliminate, and as such, the children may have access to school. Therefore, one of such barriers, which is the environmental barrier to school, is that we have been undertaking what we call school adaptation or modification to make them accessible. And we have been also supporting teachers to develop individual education plans so that children that have special education needs and learning difficulties would be able to follow their daily learning process in classes. And for sure, because Handicap International, please let's go to the next slide. Because Handicap International wants to ensure that a whole lot of other things are being registered in terms of achievement. of course, we know that 41% of the recent World Bank report, which talks of which talks of the need for a greater inclusion, you will know that girls, of course, have always been at that part. Well, I do not want to say that they are neglected, because there has been constant and conscious effort to ensure that people get the understanding and see the need to send girls to school. Even though we have been making these strides, and then boom, what happened? We all know the COVID-19 struck in. But this, to some extent, created an opportunity for us to ensure that we redefined what our activities would be. Because within this period, we cannot able to support our girls fully. Because of course, we know that there was a halt. People we are not going in, we are not going out, neither coming in, everybody was just stuck, literally like the world was paused. So we conducted what we call an education needs assessment with a random sampling of 140 girls. And of this number, 68 were girls with disabilities. Of course, you would see on the screen, 98% of these reported feeling sad about school closing, because when we had the Ebola pandemic, and in March 2011, it was declared by WHO as a global pandemic. Thus, everybody has to stay where he or she is. And the children were not going to school. So 58% of these survey reported, of children reported they were feeling lonely when they were also, and 3/4 of that showing that they only study less 0 to 2 hours per day. And you will see the statistics. And for sure, the next slide, there has been a whole lot of barriers girls have been faced even before the Ebola the corona outbreak. The next slides. And but we came to realize that the barriers as transportation, accessibility, poverty, inaccessible and safe environment, all of these have been barriers that we've been fighting to ensure that we overcome, so that children with disability, especially girls, are able to go to school. Then the COVID, of course, added, we could say, like a more holistic one that we can see, because when the girls are staying home, there has been the challenge of them doing a whole lot of domestic chores in this part of the world, and parents who are giving support to these children could not provide further support because they are all staying home, no business, no work. And as we were doing the radio and teaching learning programs, we came to realize that most of the girls, or most of the children with disabilities, and the children as a whole in the nation, could not access the radio because of there are no batteries, no money to buy batteries, bad signals, because in some of the remote communities, you hardly have signal for radio listening programs. And so we decide to redesign and change what we call our approach, so that we could be able to support our girls. Now, to the next slides. One of our approach, because we have been having what we call the community-based rehabilitation volunteers. This, because the World Bank report shows that the 3 phases, in the 3 phases, we should be able to adopt what we call inclusive remote learning intervention, thereby going to what we call the recovery and being resilient. We were able to do a whole lot of redesign of our activities. And as such, we were able to support and further use our inclusive curriculum, which has always been a twin track approach. Yes, but back to the CBRVs. We go to the next slides. Our CBRVs, for sure, these are community-based volunteers. We call them community-based volunteers because they are staying within the communities they found themselves. And these are people that have been selected by their community leaders or their community people. apparently they must be people of high standards, in the sense they must be role models. And we have been encouraging people with disabilities to be part of this network. And for now, we have a network of over 100 CBRVs, and 29% of that population are female, and they have been doing tremendous work. During the lockdown and onto the post-COVID, of course, when we shall be going to that end, they have been raising awareness to ensure that the people understand the precaution and measures they need to be taken to stay safe. And because there have been what we call the radio teaching learning programs, these CBREs, they have been following children in the with disabilities in the community to ensure that they are able to follow up with these radio series programs. And the materials that we have been supporting them with, the CBRVs, of course, they have been trained, they understand HI way of operation, and they have been following in that suit to give or to raise awareness to the community. And one key other thing these CBRVs have been doing is to ensure that they raise the alarm, they raise the button, they blow the whistle should any case of violence, sexual-based violence, and all other negatives happens within the community. Of course, they are there to support. And eventually, they would do what we call referrals. They always alert us, HI, and the community people. They have been serving like a liaison officer and between Handicap International and the communities in which we operate. Because the project itself is being run, the GECT project is being run and implemented in 6 districts across Sierra Leone. And now 7 because we've just had a new district. And these people, we want to ensure that we always have a kind of harmonized practice, in the sense whatever is happening in community A is the same that is happening in community B. And they have been giving tremendous support to ensure that all of these barriers that the girls and children with disability are facing are being, they support them to ensure that they overcome those barriers. And we have another approach that we used and to support the inclusive education during the COVID-19, which is the itinerant teachers. The itinerant teachers, these are specialized teachers, in the sense we call them floating teachers, because they move from one school to the other, and they work with teachers and students with disabilities in developing what we call individualized plan, individual education plan, IEPs. Why the development of these IEPs? Because we want to ensure that these children that are having special education needs are being supported in a unique way. Because you might be having a class full of so many pupils, but every individual is having his own unique ability. So therefore, children that are having some difficulties would help the itinerant teachers to support the teachers in the class and the student teachers to ensure that these IEPs are being developed and they are being monitored and followed up. Monitoring well-being of the students has also been part of the role the itinerant teachers have been doing. They train in PFA to provide additional support. Of course, we all know during the COVID-19, a whole lot of psychological issues, trauma. So many people are just, they go moody, some go zero. So because we want to ensure that we have a continuous process, learning process, especially in supporting our girls with disabilities and children as a whole, these itinerant teachers were trained on providing PFA, psychological first aids, and they have been doing just what they were trained on. And we have been using these individual education plans. But now, of course, we have sets of children that we are in examination classes. And we just had a national exam. We are in children who are to go to lower secondary school, junior secondary school rather. They've just started the exams. So we want to ensure that we support these children because they've not been going to school. So we look at their IEPs, we redesign it, we readjust so that it would fit to what was their target, which was to take their exams. So the IEP supports these teachers together with the parents, the pupils themselves, and the community as a whole. And we had a redesigned adjustment of their IEP. And they also work with teachers in developing strategies to support children with disabilities to catch up with their learning. And for sure, we all know that during these unprecedented times of the Ebola, women and girls are at risk of violence. And because of that, the IT9 teachers, together with the CBRVs, they have been doing what we call a watchdog role to ensure that all of these are identified and be reported to the appropriate authorities. And therefore, we continue our support to the children with disability, particularly girls with disability. I thank you very much.
Thank you very much, Duma. That was extremely interesting. And once again, we will share the slides so that everyone has access to it as a record for their own files. Now, I'd like to introduce the final Youth Advocate Intervention, a video which has been produced by Esther with the voice of Esther Zulu. Esther is a student from Zambia, and she will share her lived experiences of the pandemic and the impact of COVID-19 on her education.
Ine zina yanga ndine Esther Zulu njokera ku Kapata niphunzira pa Mpezen Park Primary School ni grade 7. Yanishta affect ine maganizo because sinienda ku skulu na vintu vinango sinishta understand monga mawedzi akuti yafunika kuti muntu antandize sinishta understand. Ine mwamna nashita experience COVID-19 because ya tivalila sogolo yatu azisema student amnesty enda ku skulu pari manja hapa.
Kunyumba saenda kuma tuitions hapa chukacha kuti nilibendrama kuti mtumizire kuma tuition kabiri nice nchitoto amete zochita kuntoma kiswe kutomeno togulisa munjirandi kubwera kwa COVID kwatipangisa kuti sitingaende kuti tikagulisa tomalonda twatu so tinkacho pa nyumba so kuphunzira kamena phunzira nikuverenga ko chabe paeveka.
Chamneni wako maningi ku skulu ni kuphunzira. Maskulu ngati azasegurira manje maningaliro yanga mneni nayo eneni kuyamba kushitako business monga kugulisa vitumbuwa na kutunga madomati kuti nipeze ndrama ya kuti vanganiperekeko kuma tuition so that niyambeko kuphunzira. Chamneni yembekezera kuti ningapeze pa skulu njauti vashite provide mabaketi ya mbiri yokwanira pa skulu na sopo.
Social distancing stiziwa kuti bazambo ikwanisa bwanji mu classes chifika timaziwa tuma classes yatu ya mbiri kumankala overcrowded but stiziwa kuti chizankala bwanji pa social distance kuti bazambo isunga bwanji pamene vabwerera kuma skulu.
Sorry, colleagues, I think we seem to have a problem with the video. That's fine. We're going to make this available to you for viewing in the future. So right now, I think we're going to turn to our last presentation. Leva, are you ready to go? We're going to now turn. That's great. So Leva Sabe, who's a program specialist for UNICEF in the East Asia Pacific and Pacific Regional Office, and she's going to present on ensuring an inclusive return to school for children with disabilities. This is a new guidance developed by UNICEF. Over to you, Leva, please.
Thank you very much, Nora. Thank you for inviting us and with us I mean the Regional Office of East Asia and the Pacific, UNICEF's regional office. It's evening here, but we're happy to join and to share our experience with COVID and the inclusion of girls with disabilities when it comes to education. Particularly here in this region, we are starting to open schools again, and we want to make sure that we leave no one behind. Next slide. In my presentation, I'm going to cover briefly on a mapping report, because this mapping report is important to understand towards my presentation, the part of the presentation that will cover the guidance that's the guidance note that this region produced. In the region of East Asia and the Pacific, the prevalence of disability is somehow estimated at 3.7%, which we know that is lower than global estimates that is 10 to 15%. And previous speakers have mentioned that it's still tough to get disability data, even if we use more and more the Washington Group questions, the set of questions on child disability or disability in general. Yeah. It is important to have data to make policy decisions and programmatic decisions. And we wanted to have data and research on inclusive education in the region. Where do we stand? And I'm going to talk with the next slide about a mapping report, which is a review, both a review and a roadmap of the disability inclusive education in East Asia and the Pacific. What we aim with this report is to look at how has it been implemented, what are the successes, eventually innovative approaches, but also challenges and gaps. We have developed a theory of change based on that mapping from the region and a roadmap for the next 3 to 5 years with staged approaches to inclusive education, to a variety of contexts. So here in the region, we have low-income countries as well as middle-income countries. Next slide. Our mapping report has been developed around a theoretical framework with a number of categories. And these categories, as you can see, we have taken those from the general comment number 4 to the CRPD article 24. Now, this is a lot of numbers and letters. The general comment number 4 is elaborating on inclusive education. The CRPD, which stands for the Convention on the Rights of People with Disabilities, has put that inclusive education is the way to go. But then exactly how to do it is elaborated in that general comment. We've taken categories from that general comment to work on our mapping. So 7 categories, including whole system approach, curriculum, pedagogy and assessment, teacher support, learning-friendly environment, effective transitions, partnerships, and data and monitoring. These are 7 domains. And if we go to the next slide, we see that these 7 domains have been broken down into smaller areas. It's a very colorful slide, and I'll try to talk you through even in a short time. We had 15 countries responding. So we have 15 countries in the region, and they responded to questions on these 7 domains. And for each question, we were marking them whether they were initiating in this effort, in this area, developing, establishing, or championing, and sometimes there was no data available. Starting from the bottom of these colorful lines, when I've placed a green arrow to indicate that in the area around the whole system approach, we actually have some successes where we have countries that are championing. 3 countries are championing on legislation, on comprehensive equity legislation. 2 are championing on education laws. So when we add the yellow and the green together, we see that more than 50% of the countries in the region are actually already in a level of establishing and championing. We also have success in the areas of training, not as much as in the law, but teacher training is instrumental. So I'm going to the second green arrow, and now to the third green arrow on the top. Some success is also in data, which we have heard is very important. Yeah. But you can see that there's still a lot of work to be done. Wherever we have countries that are in blue or in orange, it means they're only initiating or developing, such as in the areas of assessment and material, where my blue arrow stands, or in ECD and early intervention. We're going to the next slide, where I can talk about key findings from this mapping exercise. So key findings, particularly on disability inclusive education, is, as I said, we still have a lot of progress to make. And we are facing negative attitudes and discrimination, which other speakers also mentioned, that these attitudes can be as well with teachers or headmasters, as well as with parents of children that do not have a disability. So in the society, lots of negative attitudes that we have to overcome. There is also still a low level of knowledge and understanding of disability and inclusion. And then people perceive inclusive education. They say, okay, when we integrate the child, but we put it in a separate room in a mainstream school, is that integration? No, so we need also to increase the understanding of what is inclusive education. It's not special needs and segregation. It's not just integration. It needs to be full inclusion and equal opportunities in education. So our roadmap, or priorities that we have identified that stand out for the coming years is more awareness raising on inclusive education, continue to strengthen teacher capacity with reformed pre-service teacher training, as well as intensified and strengthened partnerships. And one of the initiatives that we've actually started, UNICEF here in the region, together with UNESCO, we are co-leading a new network on inclusive education, and we welcome actors from the region to join. We also emphasize the importance of data, and then the M&E systems. The EMIS, the Education Management Information System, needs to also record the enrollment of children with disabilities and their learning and their progress in school. Next slide. We have a couple of particular findings on gender from this mapping, even if it's limited. Because countries say, yes, we do work on gender, the intersection between gender and disability, but mostly it comes to disaggregating data by sex and by gender. And that's where they say, yes, we are paying attention to gender or to disability. But there's more that needs to be done. We need to have more evidence, more research to be done. And we still have found in integrating children with disabilities, girls are more likely to be overlooked and left behind, even in the data collection and then in the explicit articulation of actions in programs and strategies. Next slide. And I'm going to start talking now about the guidance note. So with COVID, we have all taken action on digital learning at school and supporting children with disabilities. But the guidance note that we have developed is about return to school. Now, there are certain steps that need to be taken before the schools open, and then there's also actions that need to be taken while the school is functioning. This guidance note has been developed by UNICEF together with CBM Australia here in the region. And it is intended for UNICEF staff, also for policymakers and planners, I would say in the region, but it could be globally across the world. I'm going to the next slide just to highlight that we have the same 7 areas from the mapping. That's why I wanted to speak about the mapping first. Yeah. The resource, the guidance note, has been shared beforehand, and if you haven't received it, will be shared afterwards. I'm not going to speak on the recommendations, specific recommendations in every single of these domains, but I'm going to speak of particular country experiences in this region, and that they might inspire you. So what countries in the region have done. Next slide. So the first category of actions is about the whole system approach. And under the whole system approach, and UNICEF is an organization that often works at system level, that works with the government. Yeah, we are thinking about work that has been done, for example, in Laos and in Myanmar about school reopening plans, and an explicit measure is included for girls and boys with disabilities. We also heard that poverty is a big aspect for children not to return to school. So both in Thailand as well as in Cambodia, there have been social protection programs, national cash transfer programs that focus on vulnerable households affected by COVID, and these include also households with children with disabilities. Just like the colleague from Humanity and Inclusion was presenting, the importance of home visits and virtual follow-up with children with disabilities. This has been implemented in Vietnam as well as in Laos. Next slide. We speak about curriculum, pedagogy, and assessment. In Vietnam, the schools have ensured that girls and boys with disabilities that have returned to school had a learning gap assessment, and that whatever needs and gaps there were, it has been addressed. In Malaysia, they have established online and tele mental health and psychosocial support for parents, children, and adolescents with disabilities. We have seen in previous presentations how stressful it is for children with disabilities. So in Malaysia, they have set up a platform that was accessible remotely. In Laos, they have also worked with sign language to ensure that children with disabilities could receive information on protection and on mental health and psychosocial support. In my next slide, I'm speaking about Malaysia, where teachers have received support by the establishment of a teacher online learning support platform. And in that platform, there is an exchange, and people can also exchange on how to better ensure that children with disabilities, particularly girls with disabilities, reintegrate in school. In Thailand, an intervention was taken to ensure that the learning-friendly environment is also a safe environment by distributing supplies for hand washing in residential care facilities for children with disabilities. Sometimes children with disabilities do learn in such facilities. It's not always a system by which children go to school. There's different approaches to teaching for children with disabilities. The one before last slide is about partnerships. And I'm mentioning again Malaysia, the same example from before, but here it's with the focus on the fact that there was a partnership with the National Coalition, the Disability National Coalition, on the MHPSS provided to parents with disabilities. Also in the Philippines and in Mongolia, there has been strong partnerships in Philippines with the Council for the Welfare of Children, and in Mongolia with the Association of Sign Language Interpreters. Lastly, on data and monitoring, it's very hard to collect specific data on disability, disaggregated data on disability. And in a context like COVID, it's even harder. What is important though is that there is rapid assessments implemented to have an idea of the situation of children with disabilities. It can be specific for education, it can also be broader. So for example, in Vietnam, the rapid assessment was on short-term and long-term impacts and identifying the vulnerability for children with disabilities. I'm coming to the end of my presentation. So I want to emphasize the importance of data, but not just data, but other types of research, not just quantitative, also qualitative, and the partnership. More resources are shared. We have a number of other resources developed in the region, and all the information and the web links will be shared later after this presentation. Thank you very much.
Thank you very much for that very informative overview of your work in Southeast Asia Pacific. Khalifa, thank you. We have a very few minutes left before we need to wrap up this, this interesting discussion today. I'm going to take advantage of my position as chair to invite Samuel. Samuel, are you still with us? If so, a number of people have raised questions about how best to support teachers in order to engage effectively with the children and with girls in particular, and with the school community, to break down some of those barriers which are more about social norms, about their own attitude to ability or to gender. And Samuel, if you are still there, I'm hoping that you are, that you might answer.
Yes, I am.
In terms of your experience, how do you work with the teachers to help them reflect on their own bias, their own social norms, and have the equipment to actually do the work they need to do in the classroom?
So for Lord Cheshire's intervention, this period has seen us interact with the teachers in various forms. So even before COVID, we had a platform known as teacher mentorship, where we grouped the teachers, and then in the group we identified or we placed a teacher who is more experienced on matters of inclusion and handling disability at the school level. So this teacher becomes like a mentor to other teachers. So we managed to leverage on this forum that was formed even before COVID-19 to see how teachers can work together and share experiences during COVID, and even exchange on various personal issues that are happening to them during this period. So we did not leave the teachers behind. That is one way. The second way, we also managed to leverage on technology and come up with a capacity building platform where we developed a course that was delivered through Google Classroom on inclusive education. The idea for that was to try and prepare the teachers. So once schools reopen, what kind of environment will they expect to find in the school, in school once schools reopen? We are trying to see how these teachers can start welcoming the children back to school once schools reopen. So that's the second intervention. The third intervention that we've also done with teachers is to try and capacity build them and prepare them for the community-based learning.
I'm sorry, we seem to have lost Samuel for a minute here. Okay, Samuel, I thank you for those. We heard 3 interventions,
that
all
is
which
actually coming to realization are unsafe, and the teachers and the children's teachers who are neighbors to children. And someone kindly confirm.
Yes, we can hear you now, please. But you can wrap up now, please, if you can.
Okay. So we are also trying to prepare the teachers on how to initiate the now government proposed community-based learning structure. So those are the 3 key ways we are engaging these teachers. Thank you, Nora.
Yeah, well, thank you too. Very interesting and a critically important area of focus for us is how to reinforce and how, as you said, leave no teachers behind. I think that's a really important comment as well. We've had lots of chat in both the chat feature and the question and answer. So I hope that everyone will take a quick look at that before they sign off. Now, I think if we're all ready with Nafisa, Nafisa, are you ready to provide your final remarks?
Yes, Nora, thank you.
Excellent.
Oh, it's really lovely to hear all this fantastic work done by our colleagues today. I think what it really points out, what really is highlighted to me is the things that we already know. We know that the economic fallout of the pandemic means that women and girls are at greater risk of violence as stresses in households rise. We know that the digital divide and poverty makes access to learning even more challenging. And we know that girls are most at risk of not returning back to school. And all these things tell us and show us without a doubt that we really need to take deliberate steps to overcome these challenges. Today we had also very innovative initiatives to draw inspiration from, which I really enjoyed. These initiatives highlight the importance of a rapid assessment to assess what are the challenges, what are the assets and opportunities in the community to be able to inform the redesign of interventions and advise government. We also learned about the importance of using volunteers, the big sisters in the community, to disseminate information, because there's so much misinformation around about COVID, and also to support and counsel girls. We also learned about the importance of home linkages for learning. And I think this is something so important, particularly for children with disabilities in general. We also learned the importance of communication, how the simple act of just making a call and asking a family or a girl, how are you doing, showing them that you care really makes a difference. And we also learned about the marvelous opportunities that mobile devices has provided us, not just in terms of keeping connected, but also in terms of distance learning. But let's be honest, a lot of these interventions that we've been talking about can actually improve the quality of education on the whole, and create enabling environments for all marginalized children. And I think we should really bear this in mind in our efforts to build back better in the future. I'd also like to emphasize the importance of advocating for disability inclusion in all, and that means every COVID emergency and recovery response, not just in education, but also related to economic empowerment and food security. This is really, really important to take that multi-sectoral approach. And I'd like to add and reinforce my support to Lee's point about data. Moving forward, we must track and research the impact of all of these efforts to support girls with disabilities, because this research will really inform our future interventions, and I think it's important to do that. Lastly, I'd like to end off by signposting people to some really interesting resources. Some of them have already been mentioned here. For example, our colleague Juma from HI mentioned the research by the World Bank Inclusive Education Initiative that launched a paper on pivoting on inclusion, leveraging the lessons learned from COVID-19 crisis for learners with disabilities. It really includes some great practical advice, and I think the information will be included in the slide deck after this webinar. Also, the GEM team, Matthijs mentioned the gender report that's coming out on the 9th of October, and also the fantastic peer website has a really great analysis of where policies are and laws are in relation to inclusive education. And I'd also like to congratulate Leave and UNICEF for the establishment of the new network on inclusive education, and I encourage people to join. And please check out that guidance note on school reopening. I think that should be really useful for everyone. Lastly, I'd like to end by saying that now more than ever, we need to double up our efforts to make sure that we don't roll back on the progress made in ensuring the right to education for girls with disabilities. And we must make sure now, more than ever, to ensure that their education and no girl is left behind. Thank you, Nora, and thank you everyone for joining.
Thank you very much, Nafisa. And everyone for participating in this very productive discussion today. In the weeks following this event, we will be producing an outcome document summarizing the key takeaways from the discussion today and sharing key resources highlighted during the webinar. So look out for this in your inbox. The recording and the slide deck will also be shared with all of you. Goodbye for now, and wishing you a wonderful rest of your day.